All right, welcome, welcome. Thanks so much, everybody, for joining me this Friday for our interactive World AIDS Day conversation. I'm Derek Dangerfield. I'm an associate professor of prevention and community health, and I'm the principal investigator of PRIISE, which is a prevention science lab focused on sexual epidemiology and health promotion. Today, our session is going to be a bit different from traditional research talks or webinars. We're thinking together and laying the intellectual groundwork for something that many of us have been waiting to see. We're talking about a life course perspective on health and quality of life for Black sexual minority men, which coincidentally is the focus of a new edited volume being published by Springer this season. It features significant contributions from our guests today, doctors Ricky Bluthenthal and Terrell Winder. To get us started thinking about life course as a theoretical orientation, really understanding that when we're talking about life course, it really helps us conceptualize how outcomes are experienced in and over time. And it reminds us that health is not a moment, it's a trajectory. So, what we often call risk in reality, especially for Black gay and bisexual men, is not a moment. It's a combination of timing, it's a combination of development, opportunities, context, and constraints. So thinking about interventions for 17-year-olds is very, very different from a 34-year-old and very, very different from a 64-year-old. But we often tend to group folks together as one undifferentiated population. So we'll be talking today about different aspects of the life course for Black gay men, slowing down and asking, how does time shape health? How does age, how does identity, relationships, trauma, how do all of those things accumulate and bend a person's trajectory? And what does it mean for us in the prevention and care landscape to really support this community in particular? So I'm joined, really, really excited to be joined today by two folks who have shaped my understanding of these questions and perspectives and provided significant contributions to the forthcoming edited volume. We have Dr. Ricky Bluthenthal, who is professor and chair of population and public health sciences at the Keck School of Medicine of USC, and his work on social and structural factors and drug policy has influenced the field for decades. We also have Dr. Terrell Winder, who's an assistant professor of sociology at the University of California, Santa Barbara. I was going to say Southern California, whose research on identity, race, and sexuality offers some very, very crucial and nuanced insights into the realities and experiences of Black queer men. So I want to spend some time in conversation. I have one slide, no data, just an open dialogue of what a life course approach can really bring to prevention science, the HIV literature, and broader quality of life discussions overall. So with that, let's get it going. Let's get it going. So to help ground our conversation, I want to start with just a brief framing of life course and the conceptual anchors that we're talking about, really thinking about why and how a life course lens on health and quality of life for Black sexual minority men is so important. Remember that when we're talking about life course and prevention science, we're trying to think about how risk, how vulnerability, and how health evolves over time, right? So the first construct we're talking about is timing. And this is the idea that age and developmental stage where people are in their life matters and how we approach them, how we study them, what their needs are. Like I said, a behavior at 16, 25, 45 75 may mean very different things and trigger different outcomes depending on people's social roles, their expectations, their health beliefs, as well as the resources that they have at the time. The second one is transitions, thinking about how we um, understand and identify those major shifts that people go through, new relationships, new, changes in job status, changes in partners, changes in family dynamics, and their subsequent evolving health behaviors. So these are moments where trajectories, health outcomes can really be shaped at key points. We also talk about critical periods, which are those time frames of specific experiences and the ways in which people navigate their lives through normal development. And for Black gay men, bisexual men, other sexual minority men, these contexts and periods might be early socialization, coming out, relationship dynamics, um, emerging adulthood, key periods of vulnerability and navigation. We also have linked lives, which reminds us that nobody really moves through the world alone, regardless of where you are, who you are. And so thinking about how health is shaped through social networks, social relationships, partners, families, peers, and communities, and the ways in which those relationships either support, constrain, or um, destabilize us over time. Finally, we have a very key and overlooked concept about the role of human agency, thinking about how, even within structural constraints, some folks are making choices and exuding resilience or resistance. They're shaping their own identity and they're taking actions into their own hands that really can support their possibilities in the future. And so collectively, I just wanted to orient us to remind us that these constructs of the life course framework really challenge us to see Black gay men and health outcomes not as a single point, but as a context and a trajectory that's shaped by development, time, and social ecological systems. So with that, I'd love in mind, I'd love to turn it over to our guest to help us think through how we can use this lens to reshape the field. And so one of the things that strikes me about a life course lens is that it forces us to really think about risk differently. We often in public health frameworks and care frameworks, we often treat risk as a one moment in time for a particular identity, for a single behavioral profile, when in reality, we know that these things are shaped by many different things. So to me, life course adds a lot of context, a lot of depth, and also humanity to how we conceptualize health. But I'm interested in your thoughts about how life course either challenges or enriches how we think about health and quality of life for this group.
Here, you want me to go? I'll go first.
Sure.
So, I mean, obviously you and I have been in conversation about life course for a long time. One of the things in particular that I think is interesting to explore and is the sort of generational differences
Yes.
among Black sexual minority men. And I think it's a ripe area for learning and fine-tuning interventions, but also for mobilization. Um, when I think about some of the challenges that sexual minority men face, it begins with, what's their family's reaction? I'll tell a story that Derek has heard because we spent a lot of time together when he was at USC. But one of the things that really blew my mind was the contrast between how families might respond to youth who were involved in criminal justice system, gang involved, truant, versus how they might respond to their sexual minority children. Um, and um, and it was shocking, the difference. So often families were willing to tolerate a level of substance use, a level of criminality that they wouldn't tolerate for gay or same gender loving men.
Yes.
And it really kind of broke my heart as a parent. Um, uh, but as a public health person, it really brings out an important vulnerability that's sort of baked into the homophobia in the culture. And there's an opportunity for generational response. So older Black men who've sort of been through the wars, they've come out on the other end. There's a chance actually to sort of build community, and there, certainly some Black gay men organizations really do that. I think in a good way. Like I'm thinking about
Yes.
Jeffrey King, and in the is it in the meanwhile or
In the
no?
meantime.
In the meantime,
Mhm.
is a great example. Like I'm really a big fan of his, but I've always enjoyed the intentionality of that. We're saving the next generation.
Mhm.
On the other hand, I think the younger generation has lots of things to teach older men
Mhm.
in terms of how to navigate these new systems and be safe, but also build the culture and build a practice of joy, and pleasure, but also safety. So that I think it's important not to lose. There's a lot of other things I can say, but let me stop there. I do think this
Mhm.
generational opportunity is one. I'd like to see uplifted more and sort of used more intentionally.
And we've written about this. So yes.
Yeah, I'm thinking, building off what Dr. Bluthenthal was saying about, these generational questions, at least for me, is a lot of our interventions that are targeting populations that are dealing with um, stigma, because that's where my mind normally is with stigmatizing experiences, discrimination, or not being connected to family and folks in their lives and their communities in certain ways. A lot of those interventions target sexual minority men, Black sexual minority folks in general, but don't really wrap around to think about what are the types of interventions we need in the broader community. And I think we see that, you know, it's a pitfall that we have, I think, across many domains in life, which is that
Yes, yes,
we
yes.
target the people who are experiencing the negative, reception, but not the folks who are kind of administering that negative reception when that's not really the source, right? That we need to be tackling it kind of from both sides. So yes, let me teach you how to deal with stigma in your everyday life across the life course, the things that may happen to you across life, but also we need to be thinking about how then do we try to mitigate that and lessen that impact, or lessen the likelihood that that could happen to you across your life, of course, your life course, by engaging with folks within different communities, people who
Yes.
may hold those beliefs or use those experiences against you in certain ways. And so I think life course teaches us a lot to think about. And in particular, I think we're at a very unique moment thinking through, especially I think thinking through World AIDS Day. I mean, you have an entire almost cohort generation that was missing, right?
Is
Folks
missing.
who
Yes, yes.
we lost during a certain period of time. And now I think we're starting to get more researchers who are interested in aging for populations where they had not aged because they had been drastically impacted by the AIDS epidemic at the outset. And so thinking about what's that link, what's that connection, how do younger folks learn from older folks who have been through certain things, and also then how our experiences are similar and dissimilar, right? The things that people went through in the past in terms of relationship dating, just understanding how the world has worked, has looked very different and looks very different now today than it did in the
Right,
past.
right.
And so how do we learn from each other, and leverage those connections across the life course, I think is an important question. But that's where my mind is about it. Yeah.
One of the things that I've been thinking critically about moving forward when we talk about intervention designs is life course can has been criticized as uh, people feel like it's not a real theory with strong constructs that could map onto interventions per se. And so thinking about what are those measures or constructs or approaches that a life course informed to help us do that? What are your thoughts about the critiques about life course as a framework?
I can give a quick answer. The one thing that comes to mind is, when I was in graduate school and working in Los Angeles, we had I was working also as a youth transitional case manager, and there was a grant, or at least the way that it was laid out is we were supposed to deliver resources to out of care youth living with HIV between the ages of 12 to 24.
Yes,
And one of the things that I was always harping about in my time on the LA, like Commission on HIV, and with other folks in that realm was kind of, well, why 24? Right? Like, what's the rationale for the age, the arbitrary age cutoff that we've decided? And at that time, it's right on the heels of, I think, the Affordable Care Act, extending health care for children of their parents to the age of 26. So I'm like, well, why not 26? There were all these roaming definitions and changing definitions of what counted as youth and who didn't count as youth at that time.
yes,
And
yes,
so I think we often create these interventions with some of the things that are part of a life course now, like age in mind, but without actually taking into account the other elements, i.e., developmental readiness,
yes, yes,
preparedness, what things are happening. We would get folks who maybe learned about their HIV status when they were very young, maybe 19, 20, but then they might fall out of care and not come back until 23, 24. And then they're aged out of those young, like those services that are targeted towards that developmental stage, someone who's first starting to just engage with that. I also think there's a lot to think about in terms of, are we using the right developmental milestones based on life course to
yes,
design interventions in a way that actually attend with the fact that people have, maybe postponed or had later experiences. So whether they have an early sexual experience versus a later kind of reconciliation with their own identities and their own experiences is a different question. So sometimes we just set random age number cutoffs for programs that I think they're not actually informed by what we know is happening developmentally for different groups of people across the life course.
yes,
And I want to
yes.
see that change. And I think life course gives us an opportunity to be more intentional about that.
No, I appreciate that. I was youth once.
So
I was
weren't
like,
we all?
what is
Mm,
it? What it's over
mhm.
or is it not? I don't know. But you bring up a good point because one of the things that I've been, that we talk about all the time, we've been writing about is these developmental milestones and, key transitions that we talk about. And in my work, a lot of things that are salient involve coming out and when people come out, when they have their first, major relationship, um, entering new social networks, resource instability that changes housing dynamics, um, and even in and be, transitions in and out of healthcare services. And so I don't know if to your point, I don't know if we really appreciate how those really reshape health trajectories. Well, what are some other, if you can think of, developmental or relational kind of transitions that we think are overlooked or missed when we talk about this group? Coming out is salient, relationships.
I mean, I think there's an important piece about just what are they bringing to those experiences, and then the context that they happen in.
Yes.
And I think those things are both of those things move around a lot, right?
Mm,
So I do, and I'm going to just share an observation. So please give me a little bit of grace. I like in my own mind when I think about um, the black gay men I know. I feel like there's like two big buckets, right? So there's the bucket of I'm going to be the best human you've ever met,
mm,
right? my gay socialization or racial socialization is I'm just going to be smarter,
Mm,
brighter, better looking. I'm going to
mm.
be that uber person, which we all celebrate, right? And it's awesome to know those folks. And then there are the people who come out of context, and they either didn't have the individual resources to come up to form a persona like that, or let's be honest, there's a ton of childhood sexual abuse among our Black gay men, you know, and then the context, right? What is the socioeconomic circumstances of their family? Are they going to segregated high school? Are they, subject to incarceration? Like all of
Yes,
these things that diminish the life opportunities of everybody, but have a particular impact on gay Black men. And so, what I would like to see is a science that's actually creating theory based on what's actually happening to people.
yes,
So
yes,
just circling back to your thing about, oh, life course isn't having, we're not making enough predictions,
yes.
right? And I'm kind of like, look, dude, whatever you dreamed up about how the world works,
Mm,
that isn't how the world works. And you need to get down into the specifics of people's experiences and the things that are actually shaping their opportunities to be able to even make choices, and about how they're going to be in the world. And I think there's too little attention, and that's part of the reason why there's this crisis in social psychology, right? Where you've done all of these what they call weird Western educated, or Western industrialized educated research samples, your college students, and it turns out the things that work on them don't work on anybody else because they
yes.
make up like 2% of the world population. So you've got to ground it in the experiences that people go through. And I mean, that's why I guess I wanted to start with the generational thing, because like I think about the generational impact of my parents on me, right? Like how they shape my worldview about both who I am in the world and how to succeed, right? How to be happy. Like it was everything, even though they had their own challenges and vulnerabilities. For me, it was great. And we need to make sure that everybody's kids are getting that, right? Like someone who sees them, understands their context, and is like, this is how we get you from A to B so you can make your choices
Yes, yes,
and,
yes.
and have a rich and full life. Anyway, I'm kind of all over the place, but I mean,
I'm
I do
e
think there's a lot more work that can be done theoretically in terms of accepting, context really matters,
yeah.
and it plays out in lots of different ways. And that then, I think the other piece is this sort of cultural learning that some of us have benefited from and others never got, matters. And that's also structural, right? Like that's also influenced by what's going on with people.
You're muted at the moment, sorry.
I'm eager to find out which bucket you put me in.
Oh,
We'll
you
talk
know what bucket
offline.
you're in, man. You know what bucket you're in.
Dr. Wilder, you had some thoughts?
Yeah, I think, at least for me, I'm always coming at this from, my own vantage point through, um, from this sociological lens, thinking through these questions about some of the folks that I study and the other Black gay men that I've encountered. And one of the things that I write about, and have been writing about lately, of course, in some of my work, including like my own book that will be out next year, is this question about representation in the lives of Black gay men. And so I write about in one of those chapters about Noah's Ark and the impact that a show about Black gay men had on different groups of Black gay men when they were encountering it.
Yes,
And I
yes,
don't write about it in the book as explicitly as I probably can lay out here, which is like I focus in the book on the population that I encountered in my field site in Los Angeles as an ethnographer, and those young men generally were encountering the show Noah's Ark as teenagers. So I was in that same age group. So someone who was watching this show about Black gay men on TV at the age of 15, 14, 16, in that range. But I actually had a book workshop with, before, as I was working on the book with other Black gay men who were of different generations. And they talked about, oh, one of them had helped to produce, the show. One of them was in college at the time the show came on. And so when they were encountering this first representation of themselves on screen as seeing a circle of Black gay friends living a particular life, seeing themselves in a particular way mattered. So how they came to understand the show mattered. And I think it's a big question that I hint at and talk about, which is that for me Noah's Ark was like this moment where I remember watching Queer as Folk on TV and being like, if this is what it means to be gay, I don't think I'm like that. Like, I don't
Yes,
think this is what's going on.
yes, yes,
And then I see Noah's Ark and I go, okay, wait a minute. Now this might be more about what I can understand, what I can see. And I didn't grow up, I'm of course from Baltimore too, so I didn't grow up in Los Angeles, and they were framing Los Angeles as a place where this Black gay life could happen. I grow later to see it's a little bit different than, of course, how they have it in the show. But the young men that I encountered would say things like, I picked up my life and moved to LA when I saw Noah's Ark, or it always inspired me to do this, or I tried to create a friend group like Noah's Ark. Those young men were inspired by seeing themselves on screen in a particular way. And I think it's important for us to remember, though, that one of my biggest critiques, I think, of the media in the US, at least, about Black gay life is it is also often truncated to a particular life course perspective or a life stage. So for
yes.
many of those young folks who are seeing themselves on screen for the first time, as inspiring and positive as it was, those were adult men. And a lot of the young people who are going through crises or figuring out relationships and dating and what it means to be who I am and sexuality, that's happening at younger ages. And we don't
Yes,
really
yes.
have really good representation of that on screen. And so many of them take the message away that I can't be who I am, or I can't be the gay whatever until I'm an adult. And that's not really what's going on. So I think representation is a great example of this, especially in media. And I'm always asking this question, what does it mean to see yourself on screen, but then to take away the message that, oh, I have to postpone my gayness until I'm far away from my family, or until I'm a certain age, or until I've reached a certain milestone in my career or stability in some way. And that's not really what's happening. And so because people then feel isolated when they go through those experiences because maybe they don't have great models or examples about how to navigate that. And so it's not just in the research, but I think also even how we represent what's happening in the lives of Black gay men on screen in real life is a great kind of mirror to some of the issues that we have where we're not fully addressing the life course. We need more, all of that happening in all domains, I think, in our, in the social world, right?
I wrote about some of my Noah's Ark California life in my autoethnography that was published in 2023. To your point that, it's important to really think about those contexts and how we see ourselves, our future selves, our present self, our possible selves, right? No pun intended. And thinking about these are big questions. These are really thinking about one thing that I've been ruminating over the past, we've been talking about this over the past couple of years, is this notion of so-called structural, what are these structural forces and factors that impact people's development? And people say, broad terms like racism, homophobia, policy, and we know those don't operate in isolated moments. They accumulate and they shape risk, they shape the environment, they shape perceptions, they shape how people see themselves, they shape stress, as well as how people navigate those things, what agency they have to move forward. How how do how do we conceptualize the cumulative impact of those things, like so-called racism, so-called homophobia, so-called stress? What are you all's thoughts about those concepts and how we conceptualize them today.
Dr. D, are you talking about allostatic load, that those type of things?
These are
Right.
part of what, but the challenge is that these concepts are broad
Mm-hmm.
and inconsistently operationalized. And
Mm-hmm.
so I am open to hearing feedback from you all about what does it mean? What do we mean when we say stress? What do we mean when we say racism? What do we mean when we say structural factors? We have several announcements on local, regional, and federal levels about well, we at least did on these concepts, and they are inconsistently operationalized. What are your thoughts?
I know we've talked a lot about this. My big, as someone who does and has been working and reviewing, projects that are aimed at like ameliorating maybe some of these structural racist or, thinking about racial health equity from a structural lens is that in a lot of ways, we know what some of the answers are to a lot of the issues, i.e., if we know that black men, as we've written about in the past, that black men want nurses and doctors that look like them. And we know that, patients can do well with doctors who look like them, who they feel like they have a connection to, who have a certain type of bedside manner. That's a pipeline issue that we haven't fixed, like broadly, not just within our community, right? But also broadly, we just have a dearth of practitioners who are practicing, right? Like it's hard for people to get the care that they need from the types of people that they should be able to get it from because we don't have that. Now, magically overnight, we're not going to be able to fix this problem, i.e., the structural problem of there are not enough people being trained to be doctors or
Right,
medical professionals within the field to meet the demand for what we know we need.
right.
But when you're then putting in applications or putting in ideas for what to do in organizations or the government wants you to do, structural interventions, short of us saying, we're gonna overnight create 1,000 new doctors, like there's no way to really structurally intervene in a way that I think most organizations or funding mechanisms really want you to do.
Yes,
And
yes,
so
yes,
I know we get a lot of programs. The question is always, is this actually structural? And how do we think about structure in terms of racism or encountering and changing the trajectory of folks, navigating this healthcare landscape, that look at things that I know you and I have talked about, like, peer navigators or case man, like what does it mean to have like congruence in who's helping you to navigate the healthcare system? Because we can more
yes,
easily put someone in your life and train them to help you navigate the lack of access than we can overnight turn a bunch of folks into doctors. And, that's an issue that, dates all the way back, of course, to the whole idea of medicalization, like who can train doctors and who can't, right? And we look at our HBCUs and, are they able to produce the amount of doctors that
yes, yes,
they were
yes,
never
yes,
allowed to, or they were, in many ways, not able to produce those many doctors based on the way medicalization, kind of happened in the US in particular. So, is it a structural fix to put someone in your life who can help you navigate the system? Well, that is a question that has come up several times across many domains. And even though we have the answers to some of these, we know we need more doctors. We know we need more certain things. We can't do those overnight. So what do we do in the meantime? And I think we sometimes lose sight of the fact that these structural fixes cannot happen in a one-time intervention or a one-time project or a one-time thing because they weren't created in a one-time event. These are things that have
right.
lasted for so long that we have to think cumulatively across that. My other short point about this is this point about like cumulative load across the life courses. I don't think we have a very good way of thinking about that across all disciplines and domains in the right way.
Yes, yes, yes,
Um, and that certain methods maybe don't make it easy for you to do certain things in that way, right? Like we have folks who are taking really snapshots of time and don't think about the fact that you're encountering someone who isn't. It's not like, oh, I experienced racism yesterday, or you've observed me experience racism and that's the only time it happened in my life. You know, it's accumulation of impacts and effects across the life course, right? And so I think of Joe Fagan's work about the many costs of racism and
Yes.
how Black people sometimes don't even know or haven't even put together in their minds that it's an accumulation of the things that have happened to me that have created the stress or the boundary that I'm brushing up against. I think we have lay people interpretations of that, right? Where people say Blacks don't crack and those types of things, and then, but we're not thinking about the inside, right? Like that
Hmm.
internally, you have internalized some of these negative things that have happened over your life, but we don't really have a good way to monitor and measure that until sometimes it's too late. You're too
And they
close
have
to the issue.
hypertension. The black don't
Exactly.
crack, but the heart is broken.
Exactly. You have hypertension. You're dealing with all these other things, the stress of going to work, you know, and these questions of like, is it more stressful for me to go to this job? Is it killing me because of the experiences that I'm having? But we don't really understand how to measure that and how to mitigate that, I think, in a cohesive way across this idea of weathering or cumulative load or these other things, right, that are happening to folks.
This has been great. I wanna hear some feedback from the audience. If too, it feels like this next decade, this season, this decade will really require a lot of new tools, a lot of perspectives, longitudinal work. What are those multi-level frameworks? Um, I'm curious to learn what really feels most urgent to other people who might be doing this work. What feels urgent to you all? I want to open it up to the audience for those who might want to contribute.
Um, Thanks, Dr. D. So as a public health practitioner and leader, watching the Department of Education be dismantled and opportunities for professional practice to be dismantled. So we're not going to see all these wonderful Black practitioners that we want to see. We've been waiting for Morgan
Mhm.
State's medical
Right.
school to open
Yes.
for God
Yes.
knows how long.
Yes.
I was so excited when my husband told me, he's like, we're building Morgan State's medical school. I'm like, really? And brick and mortar, everything is going up and the school's still not open. And he's finished
Mhm.
that project.
Mhm.
So it makes me sad to see that, but a school open up in Western Maryland, right? They have a new medical school in
Mhm.
Western Maryland, but yet we still don't have Morgan open. And as a public health practitioner, what I feel like is most urgent right now, because we can't count on anybody but ourselves. The
Mhm.
cavalry is not coming. We are the cavalry. We've got
Mhm.
to figure out how to work with families so that they really understand the impact of their disengagement with their children because they don't necessarily agree with what they believe the children chose to be, right? just
Mhm.
just working on our beliefs and the way that Christianity has impacted negatively on the outcomes that we want to see in our community. I think public health really needs to figure out how to address that. And I have a couple of my staff on with us because we work with this every day. How
Yes.
do we teach families that yeah, you're going to have to accept that your child is different than you and call it what you want. But if the child is gay, they're gay. If they are bisexual, they're bisexual, whatever adjectives that they want to choose. How do you then support them, even if you philosophize and disagree with them? You want them to grow up to be a healthy, happy, full adult. And then how do we support that family so that we can get there? And we have to do it within our own community because it's
Yes.
not going to happen anywhere else.
I have a colleague that does work with families, and he fundamentally believes that you know, all parents love their children. And I say, well, you must not work with Black gay men. Because the family dynamic is huge, huge, huge. And in many cases, to Dr. Blutenthal's earlier point, there is high prevalence of not only, broad adverse childhood adversity, but sexual abuse
Yeah.
in family context. And we have seen that data consistent for the past 15 years from so thinking about how thinking about including families in public health practice is that's a critical framework, Dr. Young. I'm looking forward to how figuring out how we do that.
Yeah, we don't have a choice. I just
Hmm. Hmm.
my interest in Black sexual minority men is because of my brother. Um, he died in 1995
Mm.
from AIDS, but watching the lack of support for his community, the families that did not love and wrap their arms around their children, and we were the only ones that were. I'm like, my brother always had all the resources. It was just not a thing in our family. So what? It was
Yes,
like,
yes.
so what? We didn't talk about heterosexuals having sex. Who cares about gay people having sex? It's just our family dynamics. But I learned that it was such a thing in the community that, oh, it's we're not going to talk about it. Shh, 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 shh.
Hmm.
That
Hmm.
person is gay. We're going to pretend and call it something else. And then when they get HIV and back then AIDS, let them die by themselves because you won't let us even wrap our arms around them. So
Right,
I
right.
continue to like fight for families to like really understand and to understand what you're doing and the damage that you're creating in our communities because it's not just for that person. They're damaging our whole community.
Huge, huge, huge.
Yeah, I mean, I think one point I'd like to make is you know, um, is the political component of a lot of this. Um, so, I happen to be I fell into HIV work in the early 90s. So I did an early HIV epi study with people who inject drugs in the East Bay in Northern California. Um, so I got to see a lot of stuff, both in that community, but also in the larger gay lesbian community in the response to HIV/AIDS. One of the things there was a real political element, right? I mean, the infrastructure that has been created to address HIV is sort of unparalleled.
Yes.
Like when you, it really it is authentically unparalleled, right? So if you combine like the Ryan White stuff, you combine all of the research stuff, you combine all of the care side, and then PEPFAR, right? Like that's next level. We're not doing
Hmm.
that for cancer. We're not doing that for heart disease. So that's an enormous political accomplishment, the redirection of resources into a health problem for this particular group. Now it's a large group, right? And the good news is eventually it got to, places like East Asia and Sub-Saharan Africa and South Asia that really needed those resources in terms of the PEPFAR. Um, what hasn't happened as much so, and this continues to be the case, even in a place like Los Angeles, is that support for providing that care to gay Black men has never been there. It was not quite there in the
Yes,
Bay Area
yes,
either,
yes, yes,
even
yes.
though there was lots of resources around. And so, I mean, I think we Black folks, we need a different politics that recognizes that we really need to do coalition building and be intentional about figuring out ways how to redirect resources, right? So as a sociologist, I sort of came up in the era of William Julius Wilson, who some of you may know of, and his controversial book "Declining Significance of Race." And the thing that's interesting about the book, I mean, empirically it doesn't support that claim, but it makes a political argument about it, which I think is true, which is that we if something is for Black people in this country, in our political economy, there will be more people against it than for
Hmm. Hmm.
it. I mean, that's the history of the country. What were the occupations included in Social Security back in the 30s? Well, it sure wasn't domestic work or agricultural labor because those were areas that Black people were in. And they were intentionally excluded, right? And then there's a recognition that if this is something like we don't want to do it. So what William Joseph Wilson was trying to argue for was a politics of coalition building and solidarity, so we can get good things that they help everyone, but they also help Black people.
Yes, yes.
ACA was a great example of that. Black people disproportionately benefited from that, although it was a universal program. And so, I mean, I do feel like our politics have to move to a place, where we're advocating for universal basic income, and we're advocating for Medicaid for all, because, or Medicare for all, because the system, our healthcare system, I've been in medical schools my entire professional life. It's set up to deny care to poor people. It's a scarcity model. That's the point. That's how you create profit, right? Is you restrict it to certain groups and you make it abundantly available to other people who have more resources to pay for, right? It's sort of the same problem we've run into with housing now, right? Where it's like, yeah, we don't give people enough money to buy housing, and so there's more homeless people. It's pretty straightforward. So I do think we need a new politics that recognizes when we're actually winning and when we're not. So, like, we should be ferociously defending ACA, and we should be pushing for universal basic income. And, speaking to Dr. Young's point, I mean, we got it. When if things ever turn back, we've got to get the Department of Education back up and running, because so much of that work goes, so much of those resources go to Black communities because of the structure of federal funding for educational services. And just recognize, like that's our goal, right? We're in this whack political system where, there's a limited interest in helping us, and now there's antagonism towards it, right? And so, yeah, so that's my point. And then just recognizing that all of the structural racism we experience is usually popular political positions. Residential segregation, people love that. Like, there's a lot of political endorsement for that, both directly and indirectly. And it's not even just the redlining stuff. It's what happens when a few Black people move into a neighborhood, right? And you hit a tipping point, and then suddenly everyone's moving out of it, right? So, I mean, that stuff, we got to stop pretending like that stuff isn't real, and we have to think somberly about what are the politics that allow us to get the resources we need to support our communities and families in this authentically hostile environment.
There's also, I think, an intentional miseducation of our population, right, in a very clear way that I think, when I think of what Dr. Young brought up about this question of, do families think about, you chose this, right? You chose
Yes.
this life. This is something you chose in your sexuality. I could go on a whole side thing about like how the gay rights movement messed up by trying to convince everybody that you're born this way, because who cares if I was born this way or not? Maybe I did choose it. And if I did, that doesn't mean I don't deserve rights. So that's a
Right,
whole side
right,
thing.
right,
But
right, right,
this
right.
larger question about, to me, it's the sociology of it all, insofar as what are the things that we think of as individual level problems versus these social issues. Whose fault is it that you are at the mercy of these particular things that have happened in your life? And I think sometimes there's a huge disconnect in folks who have not been taught to think about it in that way, where we reinscribe this idea of individualistic choice in agency in areas where we shouldn't be. Yes, there's
Yes.
agency and there's choice. Yes, those things happen. But I think we often sometimes overlook the structural impacts, or can't even wrap our minds around the way that structure is shaping what's going on within particular communities. And I always say, like, we don't do a good enough job teaching folks how to understand just like basic statistical things, like
Yes.
understanding that you are not an anomaly in some way. You actually fall into the statistic, and there's a reason why that exists in the way it is. But you don't often encounter those things until you are maybe an undergraduate, or like maybe in the educational system, to think about social issues not as a personal problem but actually as a social issue, right? It's not, oh, this person doesn't work, this person can't get ahead, oh, it's because of all their choices. It's like, no, actually, we don't have enough jobs, and Black people are being less likely to get those jobs, right? And we have
Right.
a lot of research that shows us that, but I don't think we're often exposed to that until you reach a certain educational threshold, right? Like, we have the evidence that shows that it doesn't matter if you went to the best school, if you are a Black man, or a Black person with a degree you're still going to get less callbacks than a white person who did not have a degree who had been incarcerated, right? Like those things happen, but we don't really talk about it enough in our communities, I think, to teach people that you can't look at everything as an individual problem or it's that person's fault. And so we have to think about these structures and how they were set up. And right now we're in a moment where people don't want to acknowledge that that's what the research has shown, right? They're
Right, right, right.
invested in trying to convince you that that's not what's happening. Um, it's up to us to make sure that that's not what's actually going on, right? That we teach people how it should be, right?
One of the things you bring up is the sociology of it. I come at it in the volume from a psychological perspective too, building off of the childhood sexual abuse literature among Black gay men from Sheldon Field's work in 2008, where folks qualitatively would say, I'm gay because I was molested, or I'm so not only does it not matter socially, but people also navigating their lives and health behaviors, they internalizing this message that, I either have a choice or I didn't have a choice to identify in this way. And that affects how they operate. And it also it affects them, cognitively, neurologically, emotionally, and sexually. So thinking about these things on multiple levels is really, 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 really salient. As we wind down, I want to give time for a few more comments if anyone has any additional thoughts. What are you all seeing and what is missing from how we are thinking about Black sexual minority men in terms of a life course approach that we've been talking about this morning, afternoon, evening, whatever the case is.
Good afternoon, everyone. Can you hear me?
Yes, yes, yes.
Let me try here and turn on my camera. Can y'all see me? I
Can see, hear
switch.
you. Yes, yes, yes.
Okay. So, hi, my name is Lavita Joseph. Thanks, Dr. Young, for inviting us to this session. I am truly honored to be here and hear everything that you all are saying. I'm not a provider, but I've been in STI HIV for some time. And I agree with a lot of what you all are saying. And oftentimes I see that we tend to address the matter at hand, whether it be a diagnosis or linkage to care or whatever the case may be. And then once we deal with that issue, it tends to be dropped.
Mm,
It's like we pass the person on like an object, and then we forget about that person and go on to the next person.
mm,
We honestly don't have enough individuals to continue to assist individuals the way that they need to be assisted. So I definitely agree that we need more people in this field. We also need more families coming together because families at times tend to be the ones with the biggest stigma or the biggest rejections. Like Dr. Young, I've been in this field and I tend to stay in this field with all the numerous offers that I've had to move on because of family members that have gone through stigma, being diagnosed with HIV, dying from HIV complications.
mm,
I recall when I relocated home to help take care of my dad, I went to the clinic and saw one of my family members there with his mother. And I said hello, and in trying to continue to go do what I went in there for, she called me and she said, "Can I speak with you outside?" And what she wanted to speak with me about was for me to speak with my family member and have him change his decision about the way he was living. And I looked at her and I said, "Auntie, I cannot do that." And she said, "Why?" And I said to her, "Because that's his choice." We all make choices in life, and oftentimes we don't realize that The choices that we make are our choices. You may not like it, you may not agree with it, but it's my choice. And irregardless of my choice, if you love me, you should love me. I believe in unconditional love. I don't understand how you can love me today because I'm doing what you want me to do and not love me tomorrow or not love me as much tomorrow because this decision was not in conjunction with what you believe. And she looked at me, she said, "How can you say that?" I says, "Because no matter what my decision is in life, I deserve to be loved.
Mm.
And no one has the right to take away that love just because my decision it does not conform with what they think." We have a lot of resources out in the community, but even with all the resources that we have, I think we still miss a lot of opportunities. And part of that is because we don't have enough people. Part of that is because of the fight that we have to go through sometimes to get to those resources. Okay, and we have to find a way for us to break those barriers.
Yes.
And like you all say, make the access to resources easier. We have to find a way. I am again so privileged to be here. I was writing notes. If you hear me turning my paper, it's because I'm turning my paper with my notes because I was writing notes as we go along. So I just want to say thank you so much to every one of you on this panel, every one of you that are here today with all that you're doing, all that you said today, because it just made me remember why I'm still in this field
Mm,
and why I'm going to be in this field until I retire. God
mm.
spare my life.
Speaking of the influence of family, of systems, of structure, there aren't always a lot of rural researchers or
Yes, yes,
those
yes.
researchers who focus on rural health. And Black folks are in the rural areas in the South.
Well,
Perhaps
we
right,
tried
even
that
more
and
than
they didn't want
the
it.
enclave. Yeah. So perhaps that those populations of Black sexual minority men, research would tell us, are in larger numbers, maybe geographically dispersed, but in larger numbers than the urban enclave. So I don't think that we should miss that group as we're theorizing and developing tools to think about analyzing questions. We've got to start doing more exploration in the rural context.
And you and I shared an R01 in the Southern context to do
Mm-hmm.
just that, which was unfortunately terminated by the
Terminated, yeah.
NIH immediately. So I join you in our continued fight for this work. I want to thank everybody so much for joining us today. Thank you. Special thanks to Doctors Bluthenthal and Winder for a critical contribution to the work we're doing. Please look out for the forthcoming edited volume being published by Springer this winter, as well as joining us for our final segment of our World AIDS Day series on December 2nd, featuring Dr. Deborah Furholden, where we will be advancing sexual epidemiology broadly, conceptualizing the role of population dynamics and health for global populations. Have a good morning, evening, afternoon, whatever the case may be, wherever you are. And I look forward to this recording will be posted on prizelab.com soon. Thanks, everyone.